So this event is the first ever National Women's Health Summit. It brings together researchers, clinicians, fundraisers, policymakers, women with lived experience, decision makers, and we have a singular focus, and that is to advance women's health through research. So as a member of the Coalition of Women's Health Research, so we represent 10 hubs across Canada that are really in the space of knowledge mobilization. And that means, how do we take the data that already exist and make sure that the data makes its way into the hands of women so that they can benefit from it? So we have 10 incredible hubs across Canada funded by the Canadian Institutes of Health Research and WAGE. We've seen real tangible advances. So in our own area with the SHAPE Hub, we've been able to get critical information about sexual health and genital pelvic pain out into women's hands, into their lives, so that they have the questions to ask family doctors, etc. But it's not enough to have this in just 10 areas of women's health. We need to see this in all areas of women's health. So I would love to see 1,000 hubs in women's health that is about disseminating knowledge.
It is important for me to be present at this summit because it's an excellent opportunity to meet with other managers who are working around knowledge mobilization among other hubs. So it's an excellent opportunity for us to chat about what went well last year, what did not go so well, and then if it went well, what can we copy or what can we also bring aboard on our hub. And it's also a great opportunity for us to share templates. So what community engagement templates did you use that really worked? And then we can also adopt those, and we can also go forward and engage with our patient partners, our clinicians, and our trainees.
At the SHAPE Hub, one of our goals is co-creation with the hub. So we stay connected to the Sex Information and Education Council of Canada. And we also are very connected with our clinician advisory board and our patient partners. So one of my favorite parts of the job is we create sexual health resources for both patients and healthcare providers. And through that work, we're always collaborating with people with lived and living experience, with clinicians and with other sexual health organizations across Canada.